name is Michael Rochlin. I'm a registered nurse and owner and founder and president of Confidential Therapeutics. Okay, well, it's a big question, but that's what we're working on. I think as a medical professional, and we're starting a group called the Oregon Cannabis Clinicians Group. So it's all clinicians, people that actually do clinical practice, see patients, sometimes privately, sometimes in a clinic setting. We're trying to move to home, but there's been a lot of barriers ever since Measure 91 got passed. One of the biggest barriers is OHA has kind of stood back and let OLCC run with all the rules without medical people being involved. So that's one of the purposes of this group. The other thing is we have the Oregon Cannabis Commission that was established by law over a year ago and came up with some recommendations, and so that's where the linkage is with medical. Those recommendations include allowing nurse practitioners and naturopaths to be legally protected to authorize, which is really important. And the second big thing is for research. There's a research ask in there of maybe 3% of the taxes. It's a drop in the bucket just to start it. And what we can do with that, we'll get started. And it'll really help the patients because right now there's a lot of uncertainty with this new vape crisis. The quality of cannabis in general now is in question. And so I'm a big fundamental believist in cannabis quality, meaning ISO, international standards, meaning ASTM, they're trying to get standards on testing, standardize everything, GMP, good manufacturing practice, GAP, good agricultural practice. So all these things matter. We have people that probably have done that. We have a lot of experienced people, especially in Oregon, which I'm very proud to say we've got some fantastic growers of the genetics. And that's a whole nother avenue of medical that we're not seeing. That's kind of been, we're starting to lose it. We're trying to gain it back and keep it from getting patented, but I don't really see that as a big short-term issue. I see trying to get it back and educate people about it being really important. Yeah, well, that's a really good question. I think as a patient, number one is trust your provider, have an open conversation. If you can't be honest with your provider, you're not going to get anywhere. So whoever your provider is, and there's a lot of reasons people don't want to have that conversation. I understand that. But so the first thing you need is legal protection. Get yourself a registration card and have your provider sign the authorization. If they don't want to sign it, go somewhere else. There are very, very few physicians I know, and the Knox doctors, Rachel Knox and her family, are probably the best. I'm working with some naturopaths, other nurses. There's a lot of people like us that really understand this medicine, but trying to get it all standardized is an issue, and so I think that's where, especially with nurses, because according to Gallup, we're like the most trusted profession. So we do education, we help people. A lot of times we don't charge a lot, certainly don't charge a lot as much as mainstream medicine, but right now there's no real reimbursement. So there's some issues with how we're gonna do this, but I see that as not a barrier, but an opportunity, especially for patients, like I said, if you can go through your provider and get good information through American Cannabis Nurses Association, that's who I belong to. We have forums, we have nurses in each state, so that's an opportunity. And then to connect with physicians, although if you look at this, it's not a prescribable medicine, so it's not in a traditional sense what a physician or primary provider would do, like write a script. We aren't there yet. So we're into the herbalist realm. So people that are really qualified are like naturopaths. You find a really good naturopath that would be willing to work with you, perfecto. You find a good herbalist that really has been through AHA, American Herbal Association, education, really understands their stuff. I know a good nurse here, Rebecca White, that's a nurse and an herbalist. Those are the kind of people that really understand this plant. That's what it's about, and the medicine that it can deliver. Well, it's all over the map. I think that's why I really believe in the nursing association I belong to, ACNA, American Cannabis Nurse Association, because one of the paths we're talking about help educating is bud tenders. For lack of a better term, bud tenders are the front line in the dispensaries. They call them dispensaries for a reason. The old medical program, as bad as people think it is, it wasn't regulated as well. It was quasi-regulated, but it was regulated. The regulatory authority didn't understand it and really didn't believe in it. That's part of the problem. But patients had access to medicine, they had access to genetics, a lot of the growers understood this. Unfortunately, we don't have a lot of data. So that is like experienced learning, which is really important, but I don't see it written down anywhere. I've asked people for their data and all, it's not to be found. So that's why this clinicians group is important going forward in order to pull in the mainstream and provide really good data. We need outcome data as well as, I want to know what patients are being given. Okay, that'll help us as providers and help the patients. And eventually with self-care, people will hopefully be able to select, do it yourself and figure out what they really need to make it more affordable. And that's another issue with patients that I find very frustrating.